Word on Health, the report with its finger on the pulse of popular medicine, with Paul Pennington. Word on Health, for your very best of health.
Around 700,000 people across the UK live with autism. It's a neurodevelopmental condition not defined by a single behaviour, but by a pattern of differences in how a person experiences, processes and interacts with the world. People with autism can face challenges in many areas of their life, but the type and severity varies greatly from one person to another. Many autistic people experience intense emotions. When stress, sensory overload, uncertainty or communication difficulties build up, some may experience a meltdown, an involuntary loss of emotional control or a shutdown. A relatively new charity, Dogs for Autism, founded by autism mum and dog behaviourist Hilary Armour, is the only UK charity providing assistance dogs free of charge, enabling their autistic partners to mitigate their disability.
The tasks that autism assistance dogs do are things like deep pressure therapy, which helps to re-regulate somebody's proprioceptive system. They lead people out of busy buildings if people start to become overwhelmed. They do road safety awareness, particularly for young adults who are becoming independent for the first time. They also will do a bit of crowd control work, creating space for people in lines or queues or crowded spaces, but also sent alert to impending meltdowns. One of the common traits of autism, not everybody is the same, but quite often an autistic person finds it difficult to name their emotions and know what they're feeling until it's happening to them. If the dog's able to get there in advance, using scent to predict that.
Give me some idea of the impact that these dogs have had.
Dogs are a bridge to independence. We have some families who, for the first time, can now go out together as a family unit for a day out or go on holiday together because the dog enables the autistic person to manage within that family grouping outside of the home. We've got dogs where they're going into school with their youngsters and they're enabling their youngsters to access education in a way that they simply couldn't do before, which means that they are succeeding and fulfilling their potential in a way they couldn't have done without a dog. We've got young people who can now go to university where they were actually very isolated and at home because they couldn't leave the home without another human being. They needed a carer in order to leave the home because the overwhelming aspects of their autism would mean that they couldn't go out alone. But the dog is trained to manage those so that young person or young adult can go out on their own. We've got dogs who are working with profoundly disabled children who also have autism, where they had no language and they had only ever said mummy. But then now they have a new word and it's their dog's name. And that dog becomes their very best friend, where they can't make friendships or hold friendships outside of that. So, the dogs are providing independence in lots of different ways, but that's what they are. They're a bridge to independence.
I know you lead a small team of talented and experienced trainers. How long does it take you to train an assistance dog for a person with autism, and how does the process work?
It's anywhere from 18 months to 2 years is what we're aiming for. Occasionally, depending on the dog, it might take a bit longer to mature. So it might be 2.5 before replacing that dog. So it depends very much on the dog, the person we're placing them with, and what those needs are on both sides. We train the dog first and then we match them. So there are 2 projects running at the same time. One is the training of dogs. So we have anywhere between 10 to 15 dogs at any one time in our training program. And alongside that is our applications project, where every year we open our applications window and we then choose a group of people that we feel we can take forward onto our active waiting list. That process takes a good 12 to 18 months before somebody ends up on our active waiting list because of all of the different boxes that we have to tick along the way. So those are going alongside one another and both teams are talking to each other constantly. When we start to see traits rising up in the dogs that we're working with, we're starting to already think about, well, actually, this dog might be suitable for that person over there. And so, so that's how it works. And then we invite the people waiting for dogs into our training centre for a relationship and education visit where they can meet some of the dogs. And we start that process of seeing which dogs they might particularly gel with, see how they handle dogs, what's going to be suitable for them.
Are there certain breeds of dogs that make ideal autism assistance dogs?
We tend to go for the gun dog breeds. In the UK, there are thousands of people who have trained their own pet dogs to become assistance dogs. And as you can imagine, there's all sorts of different breeds and types of dogs in that pool. But in general, when we're training assistance dogs, we're looking at dogs who are very biddable, dogs who want to connect with people, who are followers, not leaders particularly. They're not guarding breeds. We want them just to be really easygoing, happy dogs who are just happy to work for a living. And that's really important, that the dogs enjoy what they're doing. So yeah, the gun dog breeds, Labradors, Golden Retrievers, some of the Spaniel group as well, and we mix poodle into that as well. We have some Cavapoos and some Labradoodles in our charity as well.
It's a highly bespoke service that you provide free of charge to the user, where both the dog and their partner's well-being is at the forefront of your approach, and it's only thanks to the magnificent generosity of corporate partners and the great British public. If someone listening to this report would like to support you, how can they do that?
We run a sponsor a puppy program where people can pay sort of £5 a month, and they get a little pack with a cuddly puppy, and they can follow the life of this puppy for the year. We can train as many dogs as we have the funds to train, and currently we can train 10 to 15 dogs a year. But in our last application window, 750 people asked for an application form. So there is the mismatch really between the need and what we can provide.
My grateful thanks to Hilary Armour. To find out more and to link through to Dogs for Autism, visit wordonhealth.com. That's wordonhealth.com.
Word on Health. For your very best of health.
Researchers estimate that around 4 million acupuncture treatments will be delivered across the UK this year, with demand remaining strong for pain relief, migraine management and fertility-related care. Rhiannon Griffiths is a practising member of the Association of Acupuncture Clinicians.
Traditional acupuncture is a form of ancient Chinese medicine that focuses on harmonizing the mind and the body and the emotions. It's a holistic practice. It seeks out the root cause of illness and addresses it by balancing internal energy that we also know as qi. And we use the insertion of ultrafine needles, which are the thickness of a human hair, into specific acupuncture points on the body, and that regulates the proper functioning and encourages the body's natural ability to restore its own health. Traditional acupuncture is considered to be effective at helping a wide range of conditions, really, from clearly defined complaints to more kind of general feelings of ill health and low energy. Often patients say that they turn to acupuncture as their focus is on the individual, and also the lack of side effects also plays a really big role why people want to come for acupuncture.
Rhiannon, one of the popular myths surrounding acupuncture is about the needles you use, and statistics show that around 20% of the population have a significant fear of them.
Before I had acupuncture, when I was a teenager, I was a needle phobic. I would never even have considered it. But acupuncture needles are so fine and so tiny. People think that acupuncture is going to be the same as having an injection, and it just isn't. For us, less is more. A credible and well-qualified acupuncturist will choose their points very carefully so that it's for the utmost comfort of the patient.
There is a view that acupuncture is no better than the placebo effect, but there is scientific data to show that it can be helpful. It's even offered in parts of the NHS, particularly in some pain services, GP practices and hospices, although provision does vary across the UK, meaning that many of us would have to access it privately. You spoke there of well-qualified and credible traditional acupuncturists. What kind of training do you receive, and what should those of us who are looking to turn to acupuncture look for in a practitioner?
A lot of training goes into becoming a traditional acupuncturist. There is a minimum 3-year full-time degree level course, and that can be BSc or BA. And as part of the course, we look obviously at Chinese medicine and everything from that perspective, but all of the degree courses also include conventional medical training as well. So we have a very broad base of knowledge that we can apply to patients when they come into our treatment room. All members of the British Acupuncture Council are trained to that degree. So you should always look for an acupuncturist who is a member, because all members have to adhere to the strict set of guidelines, and that ensures that all patients get a really high standard of treatment. We have strict codes of safe practice and ethics. Our insurance is part of being a member. We also have continuing professional development requirements. We are also accredited by the Professional Standards Authority, and that offers enhanced protection to anyone looking for an acupuncturist.
My grateful thanks to Rhiannon Griffiths. For further information, visit wordonhealth.com. That's wordonhealth.com.
Word on Health. For your very best of health.
In a recent survey by the Royal College of Obstetricians and Gynecologists, over 60% of women polled reported experiencing at least one symptom of poor pelvic floor health, such as urinary incontinence or a frequent urge to urinate. Consultant colorectal surgeon at Cardiff and Vale University Health Board, Julie Cornish, founded the Everywoman Festival after becoming increasingly concerned by the number of women she encountered in practice who had accepted symptoms as an inevitable part of ageing, childbirth, or hormonal change.
I do a lot of work sort of nationally, internationally, and I just wasn't seeing the changes that I wanted in the speed of time that I wanted. And I'd seen a lot of the media out there around menopause and felt that that was a really powerful way for women to connect and get their voice heard. But no one's going to come to an incontinence festival. So I basically wrapped my bit of health around the wider bit. And the other reason for that was that actually, we don't just get a health problem at one point in time. Some women have it much earlier, some women have it later. And if you have the education, then you know when to seek help. Lots of people have minor symptoms that they may just consider to be completely normal and accept. And I think part of that is a societal issue in the fact that we normalize it on TV, you see cards there, it's just discussed. Part of that is about health professionals saying, well, that's normal, you've had a baby, you're old. And part of that is just when you have lots of conversations, if women have friends and family that have the same things, then they kind of accept it as being normal. And I would argue that, yes, it is extremely common to have these symptoms, but it doesn't mean you have to accept them. And, what was accepted by women many years ago isn't actually being accepted by women today who want to continue to live a healthy, happy, active life. So part of it is about education. Part of it is about information and signposting. And part of it is about giving women the confidence and the empowerment to seek help, even if they get pushed back maybe once or twice.
Julie, just so we're clear, when we talk about pelvic floor health, what are we referring to?
There are three main organs within the pelvis for women. So we have your bladder, you have your vagina and your womb, and you have your bowel, your rectum and your anus. So they're sort of the main pelvic organs. And they lie next to each other. They're supported by a basket of muscles at the pelvic floor. But it's not just that basket of muscles, it's also your core, your abdominal muscles that are needed to sort of maintain that strength. And the pelvic conditions you can get can be one of those, it can be all of those. So you might have leak, it might be that you have to rush and you don't make it in time. It might be that you get pain or difficulty going for a wee. In terms of the vagina, it might be that you have sort of a bulge coming out. You might have a bulge of the bladder, the bowel, or the womb that comes down. You might get a lot of infections or pain or discomfort during intercourse. And from the bowel perspective, it might be that you can't control your bowels, that you have to rush to the toilet, or that you can't go to the toilet when you want, or you're going multiple times because you never feel like you're fully empty. And you can get a prolapse of the bowel coming out called a rectal prolapse. In my clinical practice, I see a lot of ladies who've had symptoms for a long time. And the frustration from my aspect is that if they'd have sought help earlier, potentially they could have got help a long time ago, which meant they wouldn't have to put up with it and impact on their quality of life. But also potentially they may have been able to have just a more simple treatment. Because for some of these conditions, the longer you have the condition, the more difficult it is to treat. And then you end up having to have more radical surgery to deal with it. And that isn't something that I want for women.
Talking to you off microphone, you are highlighting the importance of us knowing our normal and then seeking help sooner rather than later.
We need to be more comfortable with understanding your anatomy, and you need to understand what is normal within your bowel habits. And if you don't know what that is, go away and look it up. There's some really good educational sources on places like the Eve charity. Then when you know what's normal, you can look for problems. If you're kind of starting to notice that your bowels aren't working properly, you're struggling or you're having accidents, you definitely need to seek help. If you're finding it painful, if you're getting a lot of pain, that's a sign the body is something that's going on, and that persists for sort of a week or 2 weeks, depending on the severity. If you are getting problems with sex and intimacy that's interfering, if you're noticing bulges coming down that you're not sort of sure what they are, or you're feeling that pressure, that discomfort, that ache, they're things that you can go and see your GP or your primary care nurse about.
Despite pelvic floor exercises being recommended to help prevent and improve common problems such as urinary incontinence and pelvic organ prolapse, the Royal College of Obstetricians and Gynecologists survey found that almost 1 in 4 UK women don't know how to do them, and more than half either don't do them or have never done them.
Pelvic floor exercises are basically squeezing the internal muscles, and it's not your bottom. So if you're squeezing your butt cheeks, then basically that's not your pelvic floor, it's internal. And we should be trying to do them about 3 times a day, and we should be doing 10 quick and 10 slow. So there's a really good app called the Squeezy app, which is designed by an NHS physio that's available on sort of Android and Apple. There's one for men and for women because men have pelvic floor too. And it basically goes through, and you can set little alarms, but it also guides you as to how long you should be squeezing for the quick and the slow. If you do maintain it, so One, you're going to sort of maintain your control of your bladder and bowel for longer. And actually, one of the biggest causes for women to go into a nursing home in later life is both bladder and bowel incontinence. So if you want to maintain an independence in your later life, you need to keep those muscles strong, and you can't do that in a quick time. It takes about 8 to 12 weeks to start seeing changes. You can overdo them. So if you're not sure what to do, go and see a physio. You can self-refer, you can see them through the NHS. There's not a huge waiting time. There has been a massive increase in the number of pelvic floor physios, but it shouldn't hurt. So if you're not sure what's going on, go and seek help, because lots of people do it incorrectly, and that can actually lead to more problems than not doing them properly.
My grateful thanks to Julie Cornish. To find out more, visit wordonhealth.com. That's wordonhealth.com.
Word on Health, for your very best of health.
Idiopathic pulmonary fibrosis, meaning there's no known cause, is the most common specific type of pulmonary fibrosis, affecting around 32,000 people across the UK. Add in all forms of the disease, including fibrosis created by over 200 causes, and that patient population rises to over 150,000 people. Research shows public awareness of pulmonary fibrosis is poor, and many patients report feeling isolated because nobody around them understands the disease. A motivating factor behind the creation in 2010 of the Pulmonary Fibrosis Trust, by patients for patients. Its chair is Peter Bryce, who also lives with pulmonary fibrosis. So Peter, for those of us who've never heard of it before, can you explain what pulmonary fibrosis is and how it affects the lungs?
Basically, pulmonary fibrosis is a progressive lung disease that has no cure. Over 6,000 die from it each year in this country. Basically, the lungs are full of air sacs called alveoli, and this fibrosis attacks the alveoli in your lungs and destroys them, and it progressively goes through your lungs. You are basically suffocating to death over a period of time. It's not quick, and well, it can be, but usually it's not as quick as suffocation or drowning or something. Just to give an idea as the disease progresses. When you've been sprinting for 100 yards, say, and then you're really puffing like mad, you're leaning over trying to get your breath back. Can you imagine feeling like that simply by getting out of bed in the morning? At the advanced stages, that is what it's like. It is frightening.
What are the treatment options?
I guess the only cure is a lung transplant. But I would say maybe 3% of patients have successful lung transplants. So I almost discount that as a possible cure. There are certain drugs that can slow the progress down. So there's not a great deal that medics can do. Help with some of the symptoms, ambulatory oxygen or whatever. But it is what it is, I'm afraid.
Peter, I understand pulmonary fibrosis is more likely to develop in older adults, especially but not exclusively men, and the risk is higher in people who smoke or have smoked. Other risk factors include a family history of the disease, long-term exposure to dust such as asbestos, silica, wood or farming dust, certain autoimmune conditions such as rheumatoid arthritis and scleroderma, some medications, previous chest radiotherapy, and in some cases severe lung infections. However, many people like you who develop the most common form have no identifiable cause or obvious risk factors. What are the early telltale signs that people need to get checked out?
Anyone who's got a persistent cough, they need to go and see the doctor and say, look, I've had this for too long now. It needs to be investigated. And a simple x-ray could start the ball rolling. The other thing is breathlessness. If you notice you're getting more and more breathless, go and see your GP, get it looked into straight away. There are 2 drugs they can give you which helps to slow the progress down. These are called antifibrotics. So as soon as you get diagnosed, there are things that they can perhaps help you with. Maybe you might need some ambulatory oxygen because your lungs are not producing enough oxygen into your circulation system. So that's going to affect all the other organs. Sadly, we talk to a lot of people and they are scared. They don't even know what's causing all this. They don't get much information from doctors. A lot of GPs don't even know what the condition is. So they turn to us and ask for help and support. And being diagnosed, I know what it's like to be told you've got this condition. And you look at Dr. Google, you get on there and it said, I've got 3 years to live. My stomach just hit the floor. What do I tell my wife? What do I tell my grandchildren? I can't run away from this. I've got to face up to it. I've got to think of a way of controlling this myself, not just burying my head in the sand. So I can imagine what goes through people's mind. It's devastating to have that news. And then you think, why is it like this? I haven't heard of this. It can't have just been discovered in the last few weeks. It's been going for a number of years. Why has so little been done to help people? And why is so little still not being done to help people? You support the politicians, get lots of sympathy, but they don't do anything, do they? They just pay lip service to it, which is why I'm doing what I can to raise awareness. We need that.
My grateful thanks to Peter Bryce. To find out more and connect through to the Pulmonary Fibrosis Trust, visit wordonhealth.com. That's wordonhealth.com.
Word on Health. On air and online 52 weeks of the year with Paul Pennington. Word on Health. Your personal prescription for your very best of health.